Welcome to the next Dolphin management training video, treatment notes. So with this video, we're going to be focusing on how to read a patient's chart, how to complete their current visit notes, how to use the predefined notes, how to complete the next visit notes, and again, there'll be a short quiz at the end of the video to confirm your understanding. So we're going to now open up our Dolphin management. So we get to our screen, our blank screen like this, and just as a recap from the last video, we're going to look at our schedule. Okay, so we can see in this instance, we've got our three patients. We've got Deanna Phelan, who is blue and seated, and we can see on the light bar, she's seated in chair 4. We've got Nicole Moore, who's green in the waiting room, and we've got Chris Phelan, who's also green in the waiting room. So now we're going to go to our patient GPS in order to bring our next patient in. All right, so when we go to the patient GPS, we can see who's in the waiting area, who's in the treatment area, and who's ready for checkout. So we've got our patient here, Nicole Moore. We're going to click her and drag her to the corresponding chair. We press OK on our little pop-up window, and then this will take us to the patient's treatment card. So when we open up the patient's treatment card, before we bring the patient in, we just want to have a look at the details in this top section here. So we know the patient name, it's at the top here. We've got their date of birth and their age. Also, what's really important is this section here called relationships. So we can see in this instance, Nicole, her son, Zach Moore, is a patient here. This is really important with our children patients. This will have their parents listed. So it's really important before getting the patient to take a note of the parent name, because it's really important customer service that we use the patient's name and the parent's name when we're interacting with them. The other point to highlight is over on the right-hand side, you can see this flashing medical alert. So again, we want to have a look at what this medical alert is. So if I hover my mouse over it, you can see it comes up latex allergy. So this is really important to take note of. You want to make sure that you've obviously got the correct gloves, and this is something that you want to let the orthodontist know as well. So once we've been able to decipher all those bits of information, we're going to now move down to this middle section of the chart, and you'll see there's all these different columns here. So we're going to go through and learn what each column means. So fairly easy, the first column is the date. So this is the date of the treatment card entry. So when the patient had the appointment. E stands for the treatment card entry. So you'll tend to see the letter V. So V stands for visit. Then you can also see the letter N. N stands for next visit. In some instances, the entry will be the letter E, which stands for emergency visit. The next column along is ASST, meaning assistant. So whenever a dental assistant is with a patient, they're going to make sure that they put their initials in this column. The doctor is obviously the orthodontist, and you just would select the initials of the corresponding doctor. PROC stands for procedure codes. So this is where you would enter the type of procedure that the patient had and then what they're going to have next time. WKS stands for weeks for the next appointment. So if the next visit's in 8 weeks, you will write that in this column. The main section in the middle here is treatment notes. So this is where we would detail everything that happened at that visit, what the doctor did, and just making sure it's all very clear. Moving along to the next column, you've got UAW, which stands for upper arch wire. So for our braces patients, they have different wires, and we want to make sure that that's recorded in their chart. LAW stands for lower arch wire. The next column, we've got EL for elastics. So again, during patients' treatment, they will wear different strength elastics, and they will wear elastics in different patterns. It's important that that is recorded. This column here is OH, oral hygiene. There are 4 main scores for oral hygiene: P for poor, F for fair, G for good, and E for excellent. The last column here is for our Invisalign patients, so aligner change. So when we've got a patient with braces, we're not really going to be filling in this column. So the main goal with our treatment card is you want to make sure that there is pieces of information along each column. So we can see we have a V under the entry. So this patient had a visit on the 30th of June. Their assistant was DP and the doctor was Dr. Crowther, LC. They had an adjustment detailing. So then you can see here SB stands for seen by. So seen by DP, LC. U stands for upper, and this is everything that they did in the upper, so mods. L stands for lower. Again, this is everything that they did in the lower, mods. Moving along to the columns here, in our upper arch wire column, you can see 1725 SS. So this relates to the wire that they have in the upper arch. LAW is the lower arch wire, which is a 1725 SS as well. With this patient, their elastics is a class 2 elastic Fox that they're wearing full time. You will start to notice we use a lot of abbreviations when it comes to the notes. We will certainly give more guidance on what those abbreviations are. It's just important to get a bit of understanding that we need to make sure that there's information written in each column. So we can see at Nicole's last visit, her oral hygiene was P for poor. So we want to make sure we just have a little bit of a recap what happened last time, and then we're going to move on to what's happening for this visit. So while you're waiting for the orthodontist to come over, you can begin to prepare the notes. So first thing we're going to do is we're going to right click, and then we're going to select visit. So we can see it automatically fills the date, and then it's making this visit entry. And then you'll also notice that it copies what was in the previous notes down to the visit. So that's really important and very helpful. So the assistant, we're going to put in our initial. We know that the doctor is Dr. Lachlan Crowther. This procedure is an adjustment hygienist. So what we're going to do is have a look at these different bits of information and make sure we put them in the corresponding columns. So over to the right here, you'll see these 3 little dots. This is how we access our predefined notes. So if we click on this, it comes up with a whole range of the different predefined notes that we use. We know that this is an adjustment appointment because of the AD code. So we're just going to use the predefined adjustment notes. So we'll click OK. So now what we're going to do is start to tidy this up a little bit. So SB is seen by. You want to make sure you're always writing your notes in capital letters. So seen by DP LC. So if we look at this section in the blue, UAWC, upper arch wire change, 1725 NITI. So when the orthodontist comes along, they're going to change the upper arch wire. So let's get that organised in this column here. So you click on the upper arch wire column, and then we're just going to find the 1725 NITI. Great. Moving along, we've got LAWC, lower arch wire change, 1925 NITI. So same, we're going to head to the lower arch wire column, and we're going to find the 1925 NITI. Okay, then we can see here CH13 to 23. So this means we're placing chain from the 13 to the 23. So we know that that's going to occur in the upper. So next to U, we're just going to repeat what's written above, CH13 to 23. Then we use a colon to sort of differentiate the different aspects. The next point we have going along is LIG 3344. So again, we know that those teeth relate to the lower arch. So again, we're just going to repeat this LIG 3344. The last note here is start vertical elastics. So the orthodontist is going to give a little bit more information as to what strength and exactly how this patient is going to wear their elastics. So what we can do in readiness for that is we can just start to clear this column, knowing that once we get the information from the orthodontist, we'll need to fill this in. And it's also going to be good to get a little bit of information from the orthodontist about the oral hygiene. So now that we've sort of entered in everything that's happening, you can delete that top line. Just makes it a little bit cleaner when you're looking at your notes. So when the orthodontist comes over, they will have a look at the notes and then they're going to confirm what happened. So in some instances, what we've written here, we need to go back and change. So we're going to have a look at a little bit of a video now of an orthodontist in action and then how we go about changing those notes.
Today we've got Darcy. She's in for an upper or right arch wire chain. We're chaining 13 to 23 and then leads on the 3, 4 and 4, 3.
Great. All right, Darcy, how are those braces going? Fantastic. Nothing's pinching or stabbing or sharp there. It's very good. All right. I might just get it and comfortable. Darcy's teeth. So, today, we've done upper arch wire for knowledge, 1725 NITI, lowers to a steel, we've changed the 1 3 to the 2 3, got leaks on the 3 3 4 4, which is next to the 20 on the 4 4. So let's do another one. Cody, rather than a lead, we're going to Cody on the 4 4. We're going to do a short class 2 elastic on the right side from the 1 3 to
And what animal would that be?
that would be rabbit, and we would like to see Darcy when we take next time maybe 8 to 10 to check her progress with the elastics.
Okay, so let's now have a look at our patient's notes and then see how we can update those based on what Dr. Crowther said. So we completed the upper arch wire and the lower arch wire change, so that's correct. He did note that instead of doing ligs, we did a Kobe on the 1 3 and a Kobe on the 4 4. So we're going to change that now. So Kobe 4 4, and we did a Kobe on the 1 3. So with the elastics, he said a short class 2 elastic rabbit on the right hand side. Okay. Just for the purposes of the training, we'll say that this patient's oral hygiene improved to good. Great. so that's everything correct for this visit. So now we need to put in the next visit. So we'll go right click, next visit. So we obviously don't know who's going to be the assistant at the next visit. So we're going to say clinic, and we know the orthodontist is Dr. Crowther. Now, Dr. Crowther mentioned in the video that he would like to see Nicole in 8 weeks for an adjustment hygienist. So we know our codes already, so it's going to be an ADH15 in 8W, 8 weeks. And what he would like to do at this visit is check progress with elastics. Brilliant. So now that we're happy with our notes and our next visit notes, we're going to press OK. So what this is going to do is now save our notes, and it's going to ask, do you want to move this patient to the next GPS status? So we know that the patient starts in the waiting room. They then move to the treatment area. So the next GPS status that they're going to move into is the checkout. So we're going to say yes. So now we get taken back to this patient GPS, and then we can see the patient is seated in the ready for checkout. So just a little bit of a recap when we're looking at the notes. If you ever want to open a patient's treatment card, you can go to the schedule, find the patient you're looking for, and right-click treatment card. So again, we've got the date, entry, assistant, doctor, procedure, weeks, treatment notes, upper arch wire, lower arch wire, elastics, oral hygiene, and aligner. So one thing you'll notice here is there are these little red locks. So you unfortunately can't make any changes to notes when there are the red locks. So if you need to go back and change some notes because you forgot something or you'd like to add it, you just need to press the red lock until it turns green, and then you can make any notes that you'd like. Ideally, we should see all black appointments and one blue appointment being the next visit, and that's why you can see the N there. Unfortunately, Nicole's notes didn't merge perfectly because this is just a training video. So we can make this treatment card look nice and clean, where you can unlock it and then delete entry. So this is what some nice, healthy treatment card looks like. You've got your visits, and then you've got your next visit entry. And we always want to save changes. All right, great. Well, thank you for listening to our treatment card video. If you do have any questions, do speak to your buddy. A lot of the abbreviations will get easier, but the real key with the treatment notes is making sure you put information in each column. All right, thank you for watching, and good luck with your training.